Are you taking a multivitamin every single morning because you believe it is a simple safety net for your health? Maybe you keep a small routine on your kitchen counter. One bottle for your bones, one for your heart, one for energy, another for memory. Perhaps there is a calcium tablet after breakfast, a soft gel after lunch, and a handful of capsules before bed. And like many adults over 60, you may have been taught your whole life that vitamins are always good, always safe, and that if a little helps, then more must help even more. That idea is extremely common. It also sounds very reasonable. After all, vitamins are sold everywhere. They are displayed next to smiling pictures of healthy seniors hiking in the mountains, laughing with grandchildren, and living long, vibrant lives. The labels use reassuring words like natural, essential, heart-supportive, bone-strengthening, immune-boosting, and healthy aging. So it is easy to believe that a supplement bottle is automatically a good thing. But after the age of 60, that assumption can quietly become dangerous. What many older adults do not realize is that the body changes the way it handles supplements with age. The stomach may not absorb nutrients the same way it once did. The liver may process substances more slowly. The kidneys may not filter excess as efficiently. The body's fluid balance changes. Medication use becomes more common. And when all of these things happen together, something that seemed harmless in your 40s can become a burden in your 60s, 70s, or 80s. That is why today we are going to talk about 4 vitamins, or vitamin-related supplements, that deserve much more caution after 60. This is not because vitamins are bad. They are not. It is because your body is more sensitive now, and the line between helpful and harmful is often much thinner than people realize. Hello, I'm Dr. Adrian Keller, and in today's video, we're talking about one of the most misunderstood parts of healthy aging: the hidden risks of certain vitamin supplements after 60. This is a topic I care deeply about because I have seen many older adults do something very understandable. They try to take responsibility for their health. They try to be proactive. They want strong bones, a healthy heart, clear thinking, and enough energy to stay independent. So they build a supplement routine because it feels like a form of protection. And sometimes a supplement truly can help. There are real deficiencies. There are real medical reasons for certain vitamins. There are situations where a doctor identifies a problem and a supplement becomes exactly the right tool. But the key word there is tool. A tool only helps when it is the right one, used correctly for the right job. If you use the wrong tool, or the right tool in the wrong way, you can create damage instead of progress, and that is exactly what can happen with supplements in older adults. Before we get into the 4 vitamins, I want to explain why supplement use becomes more complicated after 60. This matters because once you understand the body's changing machinery, everything else makes more sense. Think of your younger body like a new, high-performance car. The filters are fresh. The engine is efficient. The warning systems are sharp. The fuel system works smoothly. If you overdo something occasionally, the system can often compensate. The body clears excess more easily. It adjusts more quickly. It bounces back faster. Now think of the body after 60. It is still capable. It is still valuable. It is still strong in many ways. But it is not brand new anymore. The systems are more delicate. The filters are not as fast. The margins are smaller. The body does not always clear excess efficiently. And unlike in youth, you are much more likely to be taking medications that affect blood pressure, heart rhythm, blood sugar, clotting, acid levels, kidney function, or digestion. That means a supplement does not enter an empty system. It enters a complex system that is already doing a lot. For example, many vitamins and minerals have to be processed by the liver or filtered by the kidneys. If kidney function is reduced, even mildly, certain nutrients can linger longer than intended. If digestion is slower, absorption may be uneven. If stomach acid is lower, some nutrients may not be absorbed properly at all. And if multiple pills are taken together, one supplement can affect the absorption or action of another. This is one of the biggest mistakes older adults make. They think of each supplement as its own separate thing. In reality, the body does not experience them separately. The body experiences the total burden. Now imagine that burden stacking over weeks, months, and years. One multivitamin, one immune support formula, one calcium pill, one eye health supplement, one vitamin for memory, another for circulation, a capsule for joints, a second multivitamin because the first one was almost finished, and a family member bought a different one on sale. Without realizing it, people can start doubling or tripling certain nutrients, not because they are careless, but because no one has sat down and looked at the full picture. This is why supplement wisdom matters more after 60 than ever before. So let us begin with the first one. Vitamin number 1, high-dose preformed vitamin A. Vitamin A is essential. We need it for healthy vision, immune support, skin, and tissue maintenance. But the form that deserves caution is preformed vitamin A, often listed as retinol, retinol acetate, or retinol palmitate. This form matters because preformed vitamin A is fat-soluble. That means the body stores it. It does not simply wash away through the urine the way many water-soluble vitamins do. If you regularly take more than your body needs, those extra amounts can accumulate. Think of it like filling a storage closet in your home. If you add one small box now and then, no problem. But if you keep adding more boxes every week without checking how much space is left, that closet eventually becomes overloaded. What once looked organized becomes crowded and stressful. The issue is not the existence of the closet. The issue is the overload. That is what can happen with preformed vitamin A in the body. Now, here is where seniors often get into trouble. They may already get vitamin A from food. Eggs contain some. Dairy products contain some. Some multivitamins contain quite a bit. Then on top of that, they may add a separate eye health supplement or immune support formula. Then perhaps there is cod liver oil. Suddenly, the same nutrient is coming in from multiple directions. And unlike a water-soluble vitamin that is more easily excreted, preformed vitamin A can build. Why does that matter? Because long-term excessive intake can be harmful. Too much preformed vitamin A may contribute to liver stress. It may also be associated with weaker bones and a higher fracture risk in some older adults. That surprises many people because they usually think of vitamins as always supportive. But here again, the rule is balance. A nutrient the body needs in a normal amount can become a problem in excess. This is especially important in older women and frailer adults who are already trying to protect bone health. The last thing they need is to unknowingly create another layer of risk by taking more retinol than the body can comfortably handle. Now, let me be careful here. This does not mean older adults should avoid vitamin A-rich foods. Food is not the enemy. In fact, colorful vegetables such as carrots and sweet potatoes are excellent because they contain beta-carotene, which the body converts as needed. That is very different from repeatedly taking high-dose preformed vitamin A in capsule form. This is one reason I am cautious whenever I see a senior taking a multivitamin plus another separate formula with retinol. It may not be appropriate, it may be unnecessary, and over time, it may become a silent burden. The better question is not, should I take more vitamin A? The better question is, am I already getting enough, and do I actually need more? If the answer has not been tested or medically reviewed, high-dose preform vitamin A deserves caution. Vitamin number 2, high-dose vitamin E. The second supplement that deserves caution is vitamin E, especially in high doses. Vitamin E has been marketed for years as a kind of anti-aging nutrient. Many people know it as an antioxidant. They associate it with youth, heart health, or protection against damage. And yes, vitamin E does play an important role in the body, but the supplement story becomes much more complicated after 60. The reason is that vitamin E can affect blood clotting. And that matters a great deal in older adults because many seniors already take medications that influence clotting and bleeding. A large number take aspirin. Others take prescription blood thinners. Some take medications after heart procedures, strokes, or circulation problems. When high-dose vitamin E is added on top of those medications, the risk of bruising or bleeding can increase. Imagine your blood as a river flowing through the body. You want that river to move smoothly, but you also want it to respond properly if there is an injury. If the body loses too much clotting strength, even a small problem can become a bigger one. In younger years, people may not think much about this, but after 60, when falls, stomach issues, vascular changes, and medication use are more common, that margin of safety becomes more important. Another issue is that many people assume vitamin E protects the heart simply because it sounds healthy and antioxidant rich. But the strongest evidence has not shown the kind of major cardiovascular protection people hoped for from high-dose vitamin E supplements. In other words, many seniors are taking the risk without getting the benefit they assume they are getting. That is the heart of the problem, perceived safety and benefit that may not match reality. Now, again, I am not saying vitamin E from food is dangerous. That would be the wrong message. Foods like almonds, sunflower seeds, and certain plant oils naturally contain vitamin E in a balanced context. Food is not the concern. The concern is high-dose supplemental vitamin E, especially when someone is older, on medications, or simply taking it just in case. There is a pattern you may notice in all 4 of these vitamins. The theme is not that the nutrient itself is evil. The theme is that after 60, high-dose supplements become less casual. They become something that should be chosen thoughtfully, not assumed to be harmless. Let us move to the third one. Vitamin number 3, large calcium supplements. Calcium is probably one of the most emotionally powerful supplement topics for seniors because people strongly associate it with bone protection. For decades, older adults were told to take calcium for their bones, especially women after menopause, and calcium absolutely does matter for bone health. But here is the problem. Calcium is often taken in a way that is too automatic, too large, and too disconnected from the rest of the picture. Many seniors take a large calcium tablet every day because they think, bones need calcium, so this must be good. But the body does not process calcium in such a simple way. Calcium is not just about swallowing a pill. It is about absorption, total intake, vitamin D status, kidney history, bowel tolerance, diet, and what your body actually needs. When you take a large calcium supplement all at once, your body receives a sudden load. If that dose is bigger than necessary, it may not be ideal. For some people, especially those with a history of kidney stones or certain digestive issues, high supplemental calcium can create problems. And even beyond kidney stones, many people experience constipation, bloating, or digestive sluggishness from calcium pills, without realizing that the supplement itself may be contributing. This is why many clinicians increasingly emphasize food first when it comes to calcium. Yogurt, cheese, sardines with bones, fortified foods, and leafy greens provide calcium in a way that is usually easier for the body to handle. It comes in gradually, along with other food factors, instead of as one concentrated hit. Now, let me be balanced here. Some older adults truly do need calcium supplementation. That can happen, especially if dietary intake is low or bone health has been specifically evaluated. But the routine use of large calcium supplements without assessing diet, kidneys, and total intake is where caution is needed. You do not want to treat calcium like insurance you can never have too much of. That is not how it works. The more intelligent question is, how much calcium am I already getting from food? And do I really need this large pill on top of it? That question alone can save many people from taking more than they need. Now let us move to the fourth and final one. Vitamin number 4. Vitamin K supplementation in people taking warfarin. Vitamin K is a very important nutrient. It plays a key role in normal blood clotting, and it also matters for bone metabolism. So at first glance, it may sound strange to put it on a caution list. But here is the key point. Vitamin K requires special care in older adults who take the blood thinner warfarin. Warfarin works by interfering with vitamin K activity in the body. That means consistency matters. If someone taking warfarin suddenly starts a vitamin K supplement, switches to a new multivitamin with more vitamin K, or dramatically changes vitamin K intake without medical supervision, the medication can become harder to manage. This is not a small issue. With warfarin, the body needs stability. Too little clotting protection increases one kind of risk. Too much clotting increases another. If vitamin K intake changes unpredictably, the medication may not work as intended. So if you are taking warfarin, vitamin K supplementation is not something to experiment with on your own. Now I want to be very clear, because this is where many people get confused. I am not saying vitamin K is dangerous for everyone over 60. I am saying that it becomes especially important to manage carefully if you are on warfarin. That is a very different message. For seniors not taking warfarin, vitamin K may be completely appropriate in the right context. But once again, this reinforces the bigger lesson of today's video. Context matters. Age matters. Medication matters. Dose matters. And that brings us to one of the most important truths in all of senior health. A supplement cannot be judged only by its label. It has to be judged by the person taking it. Now let us step back and talk about the common supplement mistakes that cause trouble in older adults, because this is where many of the real problems begin. Mistake number 1. Assuming natural means safe. This is one of the most common beliefs in supplement culture. People see the word natural and immediately feel relaxed. They assume that if something comes from nature, it must be gentle, harmless, and compatible with the body. But many powerful things in nature are only safe in the right amount. Water is natural, but too much can be dangerous. Sunlight is natural, but too much damages the skin. Iron is essential, but too much harms organs. The word natural tells you almost nothing about dose, timing, interaction, or safety. Older adults need to let go of the idea that natural is the same thing as risk-free. Mistake number 2. Taking vitamins without testing. This is another major one. Many seniors start supplements based on symptoms, advertisements, or conversations with friends. They feel tired, so they start a pill for energy. Their legs cramp, so they take a mineral. They feel foggy, so they buy a memory formula. but symptoms are not diagnoses. Fatigue may come from sleep issues, low B12, thyroid problems, low iron, dehydration, poor blood sugar control, depression, medication side effects, or many other things. Guessing with supplements can easily miss the real cause. Testing matters. If a doctor checks your levels and says, "Yes, you are low in this, and here is the dose that fits your body," that is a smart supplement decision. But taking random vitamins based on vague symptoms is often just nutritional gambling. Mistake number 3, stacking multiple products. This is extremely common. A multivitamin in the morning, a bone health pill at lunch, an immune support formula in the evening, a separate eye supplement, a sleep formula, a memory blend, a hair and nails product. Without realizing it, the same nutrients may be repeated again and again. One bottle contains vitamin A. Another contains more vitamin A. A third has vitamin E. The multivitamin also has vitamin E. The total intake grows, but the person only sees separate bottles, not the combined load. This is why I always say, do not judge your supplements one bottle at a time. Judge them as a full system. Mistake number 4, ignoring medications. This is where senior supplement use becomes very serious. Many older adults take at least one prescription medication. Some take several, and that means a supplement is never entering an empty body. It is entering a chemical environment that is already being shaped by medicines. Blood thinners, diabetes medication, thyroid medication, acid-lowering medication, blood pressure pills, diuretics, cholesterol medication, and others can all change how the body handles nutrients and how nutrients affect the body. So every time a new supplement is added, one important question should be asked. How does this interact with what I already take? Not everyone asks that question, but everyone should. Mistake number 5, thinking more means stronger protection. This may be the most human mistake of all. People want security. They want to protect themselves. And when something sounds healthy, it is natural to think more of it will offer more protection. But the body does not always reward excess. The body rewards balance. A healthy amount is helpful. An excessive amount may create stress. That is true for vitamin A. That is true for vitamin E. That is true for calcium. That is true for many supplements, especially in older adults. Now let us talk about what to do instead, because I do not want this video to leave you feeling afraid of your supplement cabinet. I want it to leave you feeling wiser, what seniors should do instead. Step 1. Adopt a food-first mindset. Food is not perfect, but it is usually the safest starting point for nutrition. Real food delivers nutrients in combinations the body recognizes. It tends to arrive with fiber, plant compounds, and natural balance. The body was built to work with food. Supplements should usually come after food has been considered, not before. Step 2. Ask for targeted testing. If you are concerned about a deficiency, ask your doctor what should be checked. Not everyone needs a giant panel, but common things like B12, vitamin D, iron status, and kidney function can be very useful in the right context. Testing helps replace guesswork with clarity. Step 3. Simplify your routine. There is no prize for having the most supplement bottles. In fact, many older adults feel better when their routine becomes simpler, cleaner, and more intentional. Fewer pills, better reasoning, less overlap, more confidence. Step 4. Review supplements alongside medications. Do not keep your supplement decisions separate from your medication decisions. They belong in the same conversation. If possible, bring all the bottles to one appointment and review them together with a healthcare professional who understands your full picture. Step 5. Support the body with the basics. This may sound less exciting than a supplement commercial, but it is more powerful. Hydration matters, protein matters, walking matters, sleep matters, blood sugar stability matters, sunlight exposure matters, muscle strength matters, social connection matters. Sometimes the best anti-aging strategy is not a new bottle. It is a boring habit done consistently. Now I want to speak directly to something emotional, because I know this topic touches more than biology. Many seniors take supplements not just because they want better numbers on paper, but because they want reassurance. They want to feel they are doing something. They want to feel protected. They want to believe they are being proactive. That is deeply understandable. There is nothing foolish about wanting to take care of yourself. But real self-care is not about taking the most pills. Real self-care is about understanding what your body truly needs and what it does not. Sometimes the wisest decision is not to add something. Sometimes it is to stop taking something unnecessary. Sometimes feeling better comes not from boosting the system, but from reducing the burden on it. If you have been feeling dizzy, foggy, constipated, tired, or simply not quite right, and no one has been able to explain it clearly, it may be worth stepping back and reviewing everything you are taking. Not because supplements are always the cause, but because they are often ignored as a possibility. And older bodies deserve that full picture. Before we finish, I want to ask you something very practical. How many supplement bottles are in your home right now? More importantly, how many of them were started because a doctor tested you and confirmed a need? And how many were started because the label sounded convincing? That is not a judgment. That is an invitation to think. Go ahead and tell me your age and where you are watching from today. And if you have ever had a supplement upset your stomach, make you dizzy, cause constipation, interfere with sleep, or simply leave you unsure whether it was helping, share that too. Your experience may help someone else, because that is how wisdom grows, not just from labels, but from honest conversation. Your health after 60 is too precious to hand over to assumptions. Your body has carried you through decades of work, family, stress, joy, recovery, and survival. It deserves a thoughtful approach now. Not panic, not overload, thoughtfulness. So let us quickly summarize what we talked about. High-dose preform vitamin A deserves caution because it is stored in the body and can become excessive over time. High-dose vitamin E deserves caution because it may increase bleeding risk, especially in people taking blood thinners or similar medications. Large calcium supplements deserve caution because they are not ideal for everyone, especially when total intake is already high or there is a history of kidney stones or digestive problems. Vitamin K supplementation deserves special caution in anyone taking warfarin because sudden changes in intake can interfere with the medication. And above all, after 60, vitamins should be used with more strategy, more context, and more respect for the whole body. I'm Dr. Adrian Keller, and in today's video, we talked about why some vitamins deserve much more caution after 60. Not because nutrients are bad, but because your body is more sensitive now, and wise choices matter more than ever. Thank you for spending this time with me. If this helped you think differently about your supplement routine, keep that conversation going. Stay curious, stay informed, stay careful with what you add to your body, and remember, the goal is not to take more. The goal is to support your health wisely, protect your independence, and age with clarity and confidence. Until next time, take good care of yourself.